you, Hazel. Yes, it's such a pity that Anja is not here, because we wanted to have a talk, and an interactive talk, not one person talking at one time. So we just try via Skype and do our best. Yes, it's just a shame. But now I'm hoping that she will be on Skype now. We have tested it during the break. There she is. Yes, we can hear you. Can you see us?
Yes, well, I can see the front row.
Okay, someone is coming. Oh, yes, okay. I think I have to move. No? This is.
Here we are.
Oh, yeah, can see me. Hi. Oh, perfect. So, Anja, as I've told that our talk was, we pre-planned it in a different way, and we just do it now as good as we can. So you start with your slides, and then we have a discussion about the barriers and the challenges in terms of assistive technology in healthcare. And we would like to join the audience in our discussion. And then you sadly have to leave us, because then I will show 2 practice examples. So this is our new format, but please go ahead. I'm looking forward to your talk.
Right, so this is my key to get going. Yes, so hello everybody. I'm very sorry I can't be there, but in the true spirit of using technology, I guess there's unavoidable that we'll have to do it by Skype. So let's hope it's going to work just as well as if I was in the room with you. So thanks very much to the organisers for inviting me to talk this afternoon, and for Kerstin to share her presentation with me. So as the title suggests, we're going to talk about the use of technology in management of chronic disorders, and already there's a little caveat there, because one of the disorders I'm going to be talking about isn't really chronic, it's a childhood problem that does tend to improve, thank God, with therapy, but the issues are the same. So we'll be talking about some perceived barriers, but also making some suggestions of where we can go in the future with this. So could you move on to the next slide, Kerstin? I've just kind of looked around a little bit and thought before we go into the details, it's quite good to look over the definitions again that have been used for the use of technology in healthcare. And there's a lot of words going around, lots of terms that have been coined over the years. So, starting early on with assistive technology, maybe computer-assisted therapy, but then more recently we have telehealth, telehealthcare, telecare, telemedicine, and so I think there's a lot of confusion about what's actually meant by it. So just sort of very briefly going over some of those definitions, if we could move on to the next slide. Just looking at telehealth, so one of the definitions that I find is provision of healthcare remotely by means of telecommunications technology. So in a way that is quite restrictive, because we're really purely looking at telecommunication and the use of remote provision of therapy. The next one with the telecare, we're now broadening it out to not just healthcare but also social care, so social services. Still looking at remote provision in people's homes, but also widening out just from telecommunication systems to including computerized systems. So we're looking at technology in a slightly broader sense there already. One of the preferred more recent terms is telehealth care. So the terms are becoming longer and longer. But here we're looking at the convergence, sorry, this is the next slide. Convergence of telecare and telehealth together, and we're looking at technology-enabled integrated approaches. So, we're integrating it with normal treatment provision, and we're basically looking for more effective, high-quality healthcare by using technology support to do it. And this is really kind of the spirit that we want to work in. If we can move on to the next slide, please. So just a little bit of background. So obviously telehealth care, whatever we want to call it, is used very widely within healthcare provision. So my background is as a speech and language therapist, and so this talk will focus on some SLT specific areas. And if we kind of look back a little bit about how SLT practice has developed over the years, assistive technology is not a new concept in this area. There has been a long history of development of alternative augmentative communication aids, AAC, for patients who really can't express themselves verbally very well, and they have become more sophisticated over the years. Also within therapy, since the 60s, we've had biofeedback systems that somehow tell the patient how well they are doing in specific tasks. For diagnostic purposes, there's a range of software that has been developed to help therapists provide quantitative data for the sort of areas that they're looking at with their clients. And so, technology is not a new concept within the area of speech and language therapy. However, it hasn't really been used very much because we needed to have very specialized hardware. It was very costly and past, and also it required quite a bit of training for the therapist to use this effectively. So new technology has really taken over since the kind of mid-2000s. So if we move on to the next slide, I'm just trying to pinpoint when things took off, and I can Google again when the first smartphone was developed, and it did come out in 1996. However, I think we all agree that's not really the kind of smartphone we're looking at there. Don't think it would be very effective in using that in therapy. So I think we're probably looking more at 2007 when the first iPhone came out, and that was very quickly followed by the iPad in 2010, which I think in terms of therapists view is kind of really the tool that they're using most. Also in looking at the whole telecommunications area, Skype was first launched in 2003. I doubt very much I would have been able to present at a conference via Skype in 2003, and so again, this whole technology has developed quite a lot over the last 15 years since then it did come out. So if we move on to the next slide, the sort of increased levels of connectivity in terms of wireless internet connection and development of these devices have really significantly increased the potential for health applications. The next slide again, we can really see that mirrored in the literature that has been published on the use of these tools. So we can see kind of evidence emerging on the effectiveness of these telehealth applications from kind of mid-2000s onwards. So there have been a number of papers looking at assessment, the effectiveness of assessment, and especially the reliability, because if you do have to assess someone remotely, you want to make sure that you don't miss any particular features that you might be able to pick up in a face-to-face situation, that especially with us talking about sound, that sounds aren't distorted, so that you get an inaccurate picture of how the patient is performing. So it's very important, but these papers were able to establish that actually we can perform accurate assessment of speech remote, and similar with treatment, a number of papers again published showing that we can provide effective treatment remotely. If we move on to the next slide again, please. There will be lots of other similar developments in other areas of health and social care provision, and so that was very quickly picked up by policymakers, by health providers then, and so guidelines had to be developed for this, and so UK Department of Health, for example, the first times in 2007, but then again 2014, 18, so they are being updated continuously, and really all the time stressing the importance of technology for improving health outcomes. And so we're not just looking at replacing something like for like, but actually improving the way that we are treating patients, making it more accessible, making it more effective. If we can move on to the next slide, it's also the professional bodies for speech and language therapists have also provided guidelines. So what I've got here is a couple of statements from the American Speech and Hearing Association, and so they very early on endorsed the use of telehealth as an appropriate mode of service delivery, but you can see stressed quite strongly that it has to be equivalent to face-to-face delivery, and this can sometimes still be an issue in terms of attitudes of healthcare providers and also the availability of devices, which is something we'll be talking about. So next slide, please. So there seems to be very positive attitudes coming from from government, from healthcare providers, that this is something we should be using. The question then is, how is this actually being implemented at the moment in clinical practice? So, as therapists, we're being told we should be using the devices, but in practice, can we do it in the way that we would like to? And so, there's some work going on. What are the actual needs of the service providers, so the therapists on the ground, how can they deal with the technology, but also what are the needs of the patients, and so the kind of motivation for using the technology can be very different depending on who's being asked to comment on it. Okay, so if we move on to the next slide then. So what we're thinking about providing you with in this presentation is really give you a snapshot of a current state of tech applications by SLTs in the UK. So this is a survey that I did with some colleagues, which sort of focused on barriers that clinicians might still be experiencing at the moment in terms of application of this technology. But then also, as Kerstin has said, have some discussion about these, but then demonstrate some new developments that hopefully will kind of show the future paths of where technology can take us with management of communication problems. So the next slide, please. So in my part, as I said, I will be presenting some results of a survey of speech and language therapists in the UK. We questioned two different sets of clinicians, one working with adult-acquired problems, a disorder called dysphagia, which is a speech problem that people experience after they've had a stroke, or with a degenerative disease like Parkinson's disease, multiple sclerosis, where their speech articulation degrades. But also with children with communication difficulties, again, it's a speech sound problem, but this time children not learning to produce these sounds appropriately. We questioned therapists about the current use of technology and also what they perceived as main barriers and facilitators in their practice. And then next slide, short slide, maybe just to say that Kerstin will then come in and provide some case studies of some tools that she's been developing. Okay, so moving on to the survey then, on the next slide. The survey, we had two different surveys. The first one with the adult-acquired dysphagia I did with my colleague, Anja, and this was as a precursor for developing some tools of ourselves, because we really wanted to see what therapists are using at the moment and what kind of barriers we might have to work around to make it an effective tool. And similarly, the survey with the therapists working with the children was done by a PhD student of mine, Lowit, who is currently developing, she's a computer scientist, and she's developing some tools for children with neurological problems. So when we're looking through the literature, a number of barriers have been identified in the past. So lack of training and education of the therapists, can they use the tools? Lack of evidence of the effectiveness of the technology. We did see earlier there have been papers published that these technologies can be effective, but this doesn't necessarily apply to specific software apps that people buy, and they kind of look at what's available and then, do they have evidence or not whether this tool will be effective. There have been some problems with professional attitudes towards telehealth, people thinking, my client might not like it at all and therefore not using it. Affordability can still be an issue, especially buying the hardware, so the iPad might be too expensive for a clinic to buy. access to IT support can be an issue, and then also having appropriate answers to the kind of treatments or assessments that you would like to do with your clients. So these were issues that were identified as barriers 10 years ago, less than 10 years ago, and so really wanted to see, with the big sort of surge of development that has happened, has anything changed about this? And maybe new barriers have come up. So if we could go to the next slide, just some very brief information about the respondents. So we had 70 SLTs working with adult-acquired dysarthria, and 158 working with neurological development delay, who responded, but unfortunately we had to remove quite a few of these because they hadn't either forgotten to sign the consent sheet or hadn't completed all the questions, so we ended up with 126 responses overall. So there was a problem with online surveys, you can't check and see whether the person's done it right at the end. Next slide, the survey structures, we had this sort of usual demographic information, but then mainly focused on three areas: device availability in clinic, device use, what were the devices applied for, and the perceived barriers. And move on to the next slide, we'll come to the results. In terms of device availability, the blue bars there are the therapists working with the adults, the red ones are the therapists working with children. But you can see there isn't actually a lot of difference between those two groups in terms of what they have available in their clinics. What you can't see that much on the graph there is that 40% of the therapists working with children, up to 70% of therapists working with adults have more than 3 devices available in their clinic. Now, devices included, we had the telephone down as a device because we were aware that sometimes that might be the only device that is available. So really everybody had a telephone or a computer, but the third group of columns there, it's tablets, iPads, they are available nearly as much as computers or telephones, so that's quite a good sign. The last column there is smartphones, and they're still not available that much in the clinics. We did find that there was about 10% of therapists really only had access to either a computer or a phone in their clinic groups, so there's some gaps still here. If we move on to the next slide, this was then saying how are these devices actually being applied in management of the clients. And what we could see there is that about 2/3 of the adults, the therapists working with adults, about 3/4 of therapists working with children did actually use some form of technology in management of their client, and the others did not. And when we asked the users what they were using the technology for, then we can see that there was a lot more use of it for treatment of clients than for the assessment of clients. Move to the next slide again. So when we looked at the assessment in a little bit more detail, we can see that it was mainly used for face-to-face assessment, and it was used more by SLTs working with adults than those with children. And that's not because they're better users of technology, it's just simply that it lends itself more to that particular patient group. And so it's mainly used for voice recording and for measuring loudness and those sorts of things. The next slide, please. Then asked them, did anyone use it for remote assessment? If people used it remotely when the client wasn't in clinic with them, it was really mainly used for administrative purposes. So either gathering information from the client, maybe taking a case history before they came in to decide how quickly they needed to be seen, or just organising appointments, so more clinical or clerical nature. There was nobody in our survey who said they were doing complete remote assessment of a client without seeing them in clinic. Move on to the next slide. So moving on to treatment. So we had a lot of therapists indicated that they use technology to support their face-to-face treatment sessions. We did have a smaller number who did actually replace some of the face-to-face sessions by the use of technology. So this could have been either remote treatment or having a reduced number of treatment sessions. with sending the patient home with some technology that they could practice themselves. Sort of practice at home with the use of technology was quite high. So 80% of therapists of our respondents said that they asked their clients to do that. Okay, if we move on to the barriers then. The first two items, they were very specific to the respondents who work with the adults. And they said that sometimes they couldn't use the technology even though they wanted to because the clients didn't have the relevant device or they didn't have the right technical knowledge. None of the therapists who worked with the children indicated that, so this just kind of shows again the differences between the age groups in terms of ownership and company to use the devices. The other items were similar across the groups of therapists and also across being either a user or a non-user of technology. So the main issue that was still cited as a barrier was the fact that they didn't have the right devices in the clinic and also the lack of appropriate software to use on these devices. There were some issues with having permission to put it onto the NHS because of data protection laws. There was some lack of awareness of suitable apps, and that was more of an issue with the non-users of technology than the users. Lack of training, interestingly, was said as a barrier for the same whether someone was a user or non-user. What I haven't put on the slide is that there was some recognition that we didn't have the right evidence base for a lot of the apps that were available at the moment. Okay, if we move on to the next slide then. So coming on to the discussion of these results. So if we're looking at device availability for a start, obviously there have been some significant improvements over the years. So when Asha did a survey in the US in 2002, only about 9% of clinicians had access to appropriate devices. By 2017, that had risen to 16%. That was an Australian survey. And our survey was just done last year, that sort of 60 to 75% of therapists kind of had access to, not just a telephone, but a tablet or a laptop that they could use, could run an app from. So that was quite encouraging. If we move on to the next slide, how are these devices used? So what we can see very clearly is they use more for treatment than for assessment. When they were being used for assessment, it was really just using the same practice as before, but replacing old technology with maybe a newer app. So, they were recording voices that would have been done with a tape recorder previously. Now they're using some app on a laptop or a mobile phone, similarly measuring loudness, measuring pitch, those kinds of things. So it hasn't really changed assessment practice, it's just used the kind of technology that we're using for it. When we look at the treatment of the disorders, one thing that came through very clearly was that a lot of the apps that therapists were using, especially the ones who work with children, didn't have apps that were specific for their disorder, so they used something similar. So there seems to be a big gap in terms of availability of the apps, which also came through as a barrier later on. The apps we used, you may predominantly use to support the face-to-face sessions, and there's a lot of evidence in the literature that it helps client engagement, client motivation, and therapists were using them to encourage the group practice. So if we move on to the next slide. So what we could really see in terms of device use is that clinicians appear to use the technology to replace traditional paper-based activities. So instead of having a board game, we have a game on the iPad. Instead of giving them a pack of papers of exercises they have to work through, it was couched as a game. And not using the technology as the kind of remote treatment tool that we saw in the kind of definitions of telehealth care, where clients were supposed to be treated in the comfort of their own home, or sort of work for things themselves. And so there's a sort of big divide between the definition of telehealth and what's actually happening in terms of these SFT services that were surveyed. Moving on to the next slide, looking at the barriers. Obviously, I kind of just showed a few prominent ones. There was quite a few more they mentioned, and we could kind of classify them into 3 different areas. So there was the kind of institutional issues or external issues outside the control of the clinician, which were, permission issues, can you download the app, etc. Do you have the Wi-Fi access, but also other relevant apps out there that you can use. Professional development issues were also cited, so lack of training of therapists, they don't know what is actually out there, where to find appropriate resources. And then, so at user level, does the client, the patient have the appropriate device and technological know-how? Okay, move on to the next slide. So if we're comparing the current barriers that emerged from our survey with those of the 2007-2011 publications that I showed earlier on, not a lot has actually changed. We're still experiencing the same barriers that were reported about 10 years back. Okay, and move on to the next slide. So, if we kind of put all this together, the current applications of the tools is really largely limited to improving client engagement and motivation, rather than providing remote healthcare. That was kind of sort of things initially when the development started, and there is a significant lack of appropriate apps or software that are once disorder specific, evidence-based, and also developed with the client's needs in mind. Sorry about that. No, that's fine. I think I've just got my page, so this is not the slide you're seeing at the moment. That was the other bit. So the availability of the devices has also improved, but it's still seen as a barrier, so that's something else we need to move. So if we move on to the next slide, that'll be the one I just talked about, and I think that's the one where Kerstin's going to come in and we'll have a little bit of discussion. Apologies for that.
Can you see me? No?
Yes, I can see you.
So thank you for all this information, and I think, are there any questions in terms of what are the problems in Germany and in England to implement apps into the therapy routine? I think we have talked a lot about this. Our aim is that an app or a technical advice is not something add-on, it's based in the routine practice of speech and language therapists or the healthcare. At the moment in Germany, we don't get paid for it. I know you are, because of the National Health Service, you have not the problem of financing Skype therapies, but still have faced the problem of implementing apps and technical devices into a therapy treatment program. It's not on. I think that's what I'm asking myself, how can we change this? Because in the future we need to have technical advices, not just as add-ons, but part of our healthcare services. So, yeah. I don't know whether someone has an idea, but I think this is the problem we face in terms of developing technical devices. We have many in Germany, it's a huge development, but they are quite standalone solutions at the moment. So, this is my opening question for you.
Maybe just a comment from the area of midwifery care. Actually, for pregnant women, there are lots of various types of apps which they can use, but none of them are evidence-based. So it's just all kinds of information and all kinds of tricks, and I don't know what that they can play with, like entering their dates, last day of menstrual period or first day of last menstrual period, and expected date of delivery and that kind of stuff, but no evidence-based information, which I think is actually a problem.
Yes, this is from the slide, no, what you said, Anja. The same holds true in speech and language therapy, lots of apps, and no speech and language therapy has been involved in the development, and patients and speech and language therapists don't know how to use it sometimes. Yeah? So this is the same problem.
Yeah, I mean, there are some developments where therapists get together and form groups and then write reviews of the apps that they're using. So it seems to be kind of coming from the ground. I think we also need to be a lot more demanding. So if find apps actually, if it's sometimes difficult to contact the developer and saying, what have you done? Did you have proper professional advice when you were developing this? Has this been already been tested? And I think people are catching on to this, the people who are developing these apps, because I've talked to a number of developers and they have engaged allied health professionals to kind of feed into the whole development, and they are getting together with universities to then do some clinical trials to measure the effectiveness. So I think it's a kind of collaboration with the technological developers, but sort of really highlighting to them that it's not just technology that's important, it's what's behind it and what it actually entails. So it's starting to come through, but it's still a big area of problem.
Yeah, but what we need is implementation studies, and envy Hazel, because you talked about you have an institute for implementation studies. We are far away from this in Germany. It's very hard to get funding for this kind of studies, which we urgently need to have an evidence-based database. We can't do it just by ourselves, so we just need a structure. So I think the UK is our role model in this term, so we can learn from you and try to convince our politicians to give more funding for this kind of research. Yeah. So one more question, or 2 more questions. Hazel is strict, but this is correct. You have to look here. I have a question that's not really much based on evidence-based. The moment we're talking of software as a medical device, we come to regulation. We need a clearance of 2A medical device. What's the experience as far as that goes, as well as in the development process? Just your kind words to that.
Sorry, I didn't understand that at all. I'm really sorry.
Software as a medical device, any kind of apps, they would require a clearance, regulation clearance. As a medical device, grade 2A. It's not just enough to just gather evidence-based information if it can function as a medical device in therapy. It needs regulation clearance from EU. So what's your experience on that, and is there anything that we can take home as a message? How do you go about it in the development process? Anja, sind die Medizinprodukte. Medizinprodukte, Qualifizierung als ein Medizinprodukt. Do you have something similar in Scotland?
Yeah,
if you want to be accepted and qualified as a medical product, you have to undergo quite a complex process.
Right, so the ethics getting really bad. I'm not going to put it up correctly, but in the UK there is a procedure that if you have something else classified as a medicinal product, you have to have it passed by the regulator. And the apps kind of link with the sort of grey area where it is a medical device or not. It seems to be that anything that's for the patient that's technological is not going to be defined as that. But if we're doing ethical applications, sometimes they're good, sometimes they're not. So I think it's still an area where people are finding their feet.
Okay, thank you. I think we stop now. Goodbye to Glasgow, Anja. Talk to you soon. Bye.